You know that feeling, that quiet, unmistakable pressure that tells you it is time. You walk to the bathroom, you sit down, and you wait, and nothing happens. Or worse, a small, hard piece finally passes, and yet you stand up with the same heavy weight still sitting inside you, as if something is jammed right there at the exit, refusing to move. If that description just made you nod, I want you to keep reading, because what I am about to tell you changes everything you thought you knew about this problem. My name is Dr. Marcus, and after decades of watching intelligent, careful adults struggle silently with this exact issue, I finally have to say the thing almost no one says out loud. This is not ordinary constipation. Is the reason the fiber has not worked. Completely different, and that single misunderstanding worked. Well-meaning water friends has not worked. The laxatives have not worked, and the endless advice from because this specific problem, the one doctors quietly call outlet constipation, becomes shockingly common as we age, and it explains a frustration that millions of people carry in silence for years, sometimes decades, without ever hearing anyone describe it properly. The frustration of doing every single thing right, drinking your water, eating your salads, taking your supplements, and still sitting on that toilet for 20 long minutes with absolutely nothing to show for it. Today, I am going to walk you through exactly why this happens inside your body, the innocent mistakes that quietly make it worse without you realizing, what to do right this moment if you feel stuck, and the tiny position change that solves this problem more often than any pill, powder, or product on any pharmacy shelf. But before we go anywhere near the fixes, we need to talk about something almost no one explains. There are actually two very different kinds of constipation, and confusing them is the reason nothing has worked for you so far. The first kind begins high up inside the colon. Stool moves too slowly through that long, winding tube. It dries out along the journey, and it can take several days to finally reach the end. Most laxatives on the market are built for this kind because most laxatives work by speeding up that upper transit. That is the constipation everybody talks about. That is the one you see in commercials. But the second kind, the one you are likely dealing with right now, is completely different. In this version, the stool has already made the entire journey. It has already traveled through the colon. It has already reached the rectum. And there, in the very last few centimeters before the exit, it has simply stopped moving, just stopped, sitting right at the door. Doctors call this outlet constipation, or in more clinical language, dyssynergic defecation. And here's the part I need you to really understand, because it changes everything. So why does the process stall right at the finish line after your body has done all the difficult work? Picture your rectum as a small holding chamber, the very last stretch of the tube before the exit. Now, wrapped around the lower part of that chamber is a specific muscle called the puborectalis. Think of it like a loop tied around the bottom of a garden hose. During the day, that loop keeps a gentle bend in the hose, and that bend is actually a good thing. That bend is what gives you control. It is what stops stool from coming out at the wrong moment when you cough or laugh or stand up from a chair. But when the right moment finally arrives, when you sit down on the toilet, that loop is supposed to release. It is supposed to relax, straighten the bend, and let everything pass through smoothly. In many people, especially past the age of 50, that release does not happen properly anymore. The loop stays tight, the bend stays in place, and the stool arrives at that curve and simply cannot get through it. Now here is where the problem quietly gets worse, and this is the part almost nobody explains to you. While that stool sits there stuck at the bend, your body does not stop working. Your rectal wall continues doing what it always does. It continues pulling water back out of that stool, the exact same way it does throughout your entire digestive tract. Hour after hour, minute after minute, what could have passed easily an hour ago becomes drier, then harder, then denser, until finally it forms a firm, stubborn plug that will not move on its own, no matter how much you strain, no matter how long you sit there, no matter how much you push. And that is exactly the sensation you know so well. That heavy, blocked, unfinished feeling that follows you through the whole day. If any part of what I just described sounds like your life, I want you to remember one word: stuck. because we are about to uncover the very first mistake almost every single person makes when they feel stuck. And it is a mistake that seems logical, seems natural, seems like the obvious solution, and yet it is the exact reason things get worse instead of better. Most people have been doing this specific thing their whole adult life without ever suspecting it was quietly working against them. And once I show you what it is, you will never look at those 20 minutes on the toilet the same way again. The mistake is straining, pushing harder, bearing down with everything you have. It sounds so obvious, so instinctive, so completely reasonable that questioning it feels almost foolish. From the moment you were a small child, you were quietly taught that straining was just part of using the bathroom. So when things stall, when nothing wants to move, your body reaches for the only tool it thinks it has. It pushes harder, it tightens, it bears down with all the force it can gather. And here is the cruel irony of what is actually happening inside you. That pushing, that straining, that desperate effort to force things through does the exact opposite of what you think it does. It does not open the loop, it tightens the loop. Picture squeezing your fist shut as tightly as you possibly can while someone stands next to you telling you to relax your fingers. The harder you force it, the more the muscle clenches against you. That is precisely what is happening at the exit of your body every single time you bear down against a stool that will not move. The puborectalis, that little loop we talked about in the last section, is not a passive muscle that simply gets out of the way when you push. It is a reflex muscle. When you strain, when you tighten your abdomen, when you hold your breath and bear down, that muscle receives a signal to brace, to hold, to grip harder. So the very action you believe will solve the problem is quietly making the door slam shut tighter each time you try. And that explains something you have probably experienced without ever understanding why. That moment when you finally give up, stand up from the toilet defeated, walk back into the kitchen or the living room, and suddenly, 10 minutes later, the urge returns strong and sharp. Why? Because in the walking, in the moving, in the letting go of the strain, that loop finally relaxed. But by then, the moment has usually passed, and the whole frustrating cycle begins again. Now let us talk about why this loop becomes so uncooperative in the first place, because there are specific causes stacking up quietly in the background of your life, and most of them started years before you ever noticed a symptom. Not enough fiber is one of them, but not the way you think. Not enough water is another. And there is one more that surprises almost everyone. Ignoring the urge when it shows up. Just ignoring it. Because you were driving. Because you were in a meeting. Because you were in the middle of cooking dinner and did not want to walk away from the stove. Because you were on a walk with a friend and it felt embarrassing to interrupt the conversation. Every time you overrode that signal, you were quietly training your rectum to become less sensitive. And we will come back to that one because it is far more damaging than most people realize. Then there are the medications, and this list is longer than people expect. Opioid pain relievers, even the mild ones, slow this exact mechanism. Iron supplements, the same ones your doctor may have recommended for anemia, harden stool and slow transit. Certain blood pressure medications, particularly calcium channel blockers, quietly interfere with the coordination of these muscles. Antidepressants, antihistamines, even some antacids containing aluminum. None of these are drugs you can simply stop taking. But knowing they contribute to the problem changes how you approach the solution. And then there is time itself, simple aging. The pelvic floor, that entire hammock of muscles that supports the whole system, gradually weakens with the decades. The coordination between the muscles that push and the muscles that release becomes less crisp, less synchronized. But the fix takes less than 1 minute to set up, and it changes everything. Take a small footstool, somewhere between 6 and 9 inches tall, and place it in front of your toilet so that your feet rest fully on it. This one small change raises your knees above your hips. Then lean forward gently and rest your elbows on your knees. That is the entire adjustment. Knees above your hips, body leaning forward slightly. Suddenly, that bend in the hose straightens out, the path opens, the kink disappears. And there is one more piece to this position, one that most people forget, and it is the difference between a good result and a complete transformation of the experience. That missing piece is your breath, and your belly, and what you do with them in that exact moment. Because you can have the perfect footstool, the perfect angle, the perfect timing, and still walk away frustrated if you make the one mistake almost everyone was quietly taught since childhood. That mistake is holding your breath and bearing down. Think about it. Think about how many times you have done exactly that. You take a breath, you hold it, you seal your throat shut, and you push with every abdominal muscle you have. It feels like effort. It feels like doing the work. But that specific action, that breath hold and bear down, sends a very particular signal to your pelvic floor. It tells those muscles to brace, to grip, to seal. The exit locks shut at precisely the moment you are trying to open it. The instruction your body actually needs is the opposite. Relax your belly. Let it soften. Let it push gently outward, as if you were letting a small balloon expand inside your lower abdomen. Do not suck it in. Do not tense it. Do not tighten it. Just let it release. Then breathe slowly through your nose, a long, calm inhale that lets your belly gently expand outward. And then, on the exhale, a long, slow breath out through your mouth. And as that air leaves your body, let go of everything. The pelvic floor, the abdominal walls, the muscles you did not even know you were tensing. You are not straining, you are releasing. Two completely different things. This runs directly against everything most of us were taught. But if you try it once, if you actually sit down on that toilet, put your feet on that stool, lean forward, soften your belly, and breathe out slowly instead of bearing down, you will likely notice something you have not felt in years. Movement. Effortless movement. The kind that used to happen without you having to think about it. Now,